In this lecture, we're going to review some of the basic principles related to exercise prescription. And this can be summarized in the following five health-related components to physical fitness that we'll address in this final part of Unit 3. So the first component is cardiorespiratory endurance, also referred to as aerobic fitness, and this encompasses exercise that is carried out at a relatively low intensity level for a certain period of time. Skeletal muscle strength is another important component of physical fitness. And when we think about developing skeletal muscle strength, there are three primary means in which this is carried out. There are what are called isometric contractions, and those are contractions in which there is no joint movement. Muscles are contracting, but there is no motion. And one example of an isometric contraction is here on the bottom part of the slide, where this person's performing a trunk muscle strengthening exercise where the person holds this position for some period of time. But from a clinical perspective, isometric contractions are very useful, particularly when joint motion is not advised or possible. So a person that's recovering from some sort of musculoskeletal injury where they're still able to contract the muscle, but the joint movement is restricted, would benefit from performing isometric types of contractions. The most common type of muscle strength development exercise are what are called just simply dynamic, which is the opposite of isometric. And so the bottom right-hand corner of the slide illustrates a person performing a dynamic type of activity where movement of the weight begins with an acceleration of the weight and then a reversal into the opposite direction. This type of exercise typically involves external loading, as this person is using external loads with dumbbells. External loading could also be body mass. And the squat exercise, and we'll touch on this a little bit later as an example, is a typical example of dynamic. One other type of muscle strength is referred to muscle strength development exercise is what's called isokinetic, and that's what you see here pictured in the upper right-hand corner. So this type of device is a computer-driven motor device in which the contractions are performed against a fixed speed of movement. So no matter how hard this person here performs a knee extension exercise against the resistance of the device here, their leg is only going to move at the prescribed speed. And this is a very common device that one would find in a physiotherapy clinic because it functions both as an exercise device and a very objective way to evaluating a person's strength. However, it is not a convenient mode of exercise to use because it's very expensive and it requires a considerable degree of user knowledge and expertise and coordinating the software program with driving the actual device. The third component of physical fitness is skeletal muscle endurance. And similar to what we see here with this person performing this trunk muscle exercise isometrically, skeletal muscle endurance is quite a bit different than cardiorespiratory endurance, where this third item here is a component in a sense of skeletal muscle strength, except that the external loading is much, much lower, but carried out for a relatively longer period of time. The fourth component is flexibility, and the whole goal of flexibility training is to increase a person's range of motion for across various joints. And the fifth component is the development or alteration in a person's body composition. And this is just simply summarized as a person's fat mass versus their fat free mass. And so one of the goals of physical fitness is to transition the amount of tissue away from fat over towards fat-free mass, and that's referring specifically to the development of muscle tissue, skeletal muscle tissue. There are a number of general benefits of regular exercise. Statistically, the first benefit here is that chronic engagement in chronic physical activity or exercise does reduce the risk for developing certain cancers. And the two cancers that seem to be most affected by this, that are statistically most related in terms of a decreased incidence in people that engage in regular exercise, is colon cancer and breast cancer. Regular exercise also statistically appears to reduce the risk of developing osteoporosis and osteoarthritis. Improving glucose metabolism, particularly in people that have been identified in being in a pre-diabetic stage, or a person that has developed type 2 diabetes mellitus. Regular physical exercise enhances a person's physiological ability to maintaining and to managing their own blood glucose levels physiologically. Regular exercise is known to reduce the risk, actually a number of risk factors for developing cardiovascular disease, and it does reduce the risk of developing obesity, or people that are classified into the overweight and obese category. Chronic physical activity does reduce that risk and will start to move a person's body composition into the direction of what is considered to be a healthy weight. And the reason this is because of a general increase in overall body metabolism. As overall metabolism increases, even just for a little bit in terms of the magnitude, but projected over 24 hours a day, 7 days a week, that comes with physical exercise, the fuel driving that metabolism would be fatty acids that would be harvested from the storage site in fat cells or adipocytes. Regular exercise does reduce the risk of falling, and this comes by way of practice. And what I mean by practice is that a person develops a better ability of what's called motor control. So the nervous system is better able to activate muscles and react to any sort of standing or walking perturbation that they could recover from a trip and not fall. And this is also related to a development of muscle strength. So a person may be able to react quickly to a perturbation if they trip as they're walking, but do they also have the muscle strength to arrest the fall by producing enough force? And so by developing both motor control and developing muscle strength, these are two factors that will reduce a person's risk of falling. Overall, some of the overall benefits of regular physical exercise include what's just simply referred to as quality of life. And what this quality of life refers to is that regular exercise has been shown to improve sleeping patterns, as well as improving overall health behaviors. When we think about health behaviors refer to a conscious decision of incorporating certain tasks in one's life. This includes the performance of regular physical activity or exercise, as well as making modifications to the diet. And one other item that's not listed here is the removal of what are called modifiable risk factors, such as excessive alcohol consumption and the use of tobacco. Improved cardiorespiratory and musculoskeletal fitness that comes with regular physical activity and exercise makes it easier to conduct activities of daily living. So a better developed cardiovascular system, a better developed ability to move air into and out of the lungs will give somebody endows a person with a greater capability of performing low-level activities, but for a longer period of time, as well as enhancing muscular strength that also will contribute to some of the more intense daily activities, such as lifting items around the home or doing so at work. And overall, the benefits of regular exercise will result in an improvement in a person's metabolic profile, the secretion and regular action of the endocrine system, which are hormones, as well as providing additional uh, support to immune function. And with enhanced immune function comes the improved ability of dealing with microbes and infections when those things do happen. So this ends the first part or the first lecture of part 3 on exercise prescription.